Secondary hypertension in the young. We continue with our discussion on hypertension in the young population, and today we discuss about the clinical clues to secondary hypertension in the young. The biggest mistake in young hypertension is treating the numbers without asking why, and this visual highlights the key warning signs that should immediately trigger suspicion for secondary hypertension. The first clue is severe or unusual hypertension. If hypertension begins before the age of 40, presents with readings over 160-100, or shows rapid progression, we must pause. Young bodies usually compensate well, so severe hypertension early in life is rarely innocent. The second clue is resistant blood pressure. When a young patient remains uncontrolled despite 3 medications, including a thiazide diuretic, it requires early evaluation for secondary causes. Do not just treat the pressure without looking for the cause. The third clue is early target organ damage. Left ventricular hypertrophy in a young patient, declining renal function, or hypertensive retinopathy tells us that the blood pressure has been both severe and sustained, often beyond what you would expect from uncomplicated primary hypertension. So, search for secondary causes. Renal clues are also very important. We said the commonest cause of secondary hypertension in the young is renal causes. Periorbital facial puffiness, that is usually a key clue for kidney disease. Frothy urine, hematuria, abnormal urinalysis, increasing creatinine. On ultrasound, if you find asymmetric kidney size, abdominal bruise, all suggest renal parenchyma or renovascular disease. These are not subtle findings, they are diagnostic clues, and especially early morning facial puffiness, that is usually suggestive of kidney disease. If you have hypokalemia or low potassium provides another powerful clue, particularly towards primary aldosteronism. Low potassium, muscle weakness, excessive urination, and increased thirst, resistant hypertension, all should immediately prompt evaluation, and especially primary aldosteronism. So don't ignore hypokalemia. Episodic symptoms raise a concern for pheochromocytoma. Headaches, palpitations, sweating, anxiety-like episodes, labile blood pressure often create a diagnosis, and you should suspect pheo. So if you find a young person with episodic very high BPs with associated headache, palpitations, flashes, think about pheochromocytoma. There are other endocrine causes that should be thought about with hypertension. If you are having unexplained weight loss, tremors, thyroid enlargement, those can be thyroid as a cause. Cushing's syndrome will have features like central obesity, stria, muscle weakness, and should make you suspect endocrine causes of high blood pressure. And finally, the overall phenotypes. In patients with coarctation of the aorta, there is radio delay, radiofemoral delay, all very simple clinical clues that can be picked. Snoring and daytime somnolence should make you think about obstructive sleep apnea. Medication history, we talked about causes of substance of abuse, cocaine, oral pills, non-steroidal anti-inflammatory, all that can be picked in the history. The message is simple. Secondary hypertension is often missed, and there are some simple clues that you can search for. Very high blood pressures, severe unexplained hypertension, very early excessive target organ damage, renal clues, the facial puffiness, hypokalemia, features of hyperthyroidism, obesity with abdominal stria, patients with hypokalemia. All these should make you suspect secondary causes. The importance of picking secondary causes early is that early recognition leads to targeted testing. Targeted testing leads to precise treatment and possibility of the cure of the hypertension, and not long-term treatment. So when you encounter a young patient with hypertension, ask yourself, is this primary hypertension, or are there clues that should suggest secondary hypertension? Save this visual, share it with your colleagues so that we do not miss secondary hypertension in the young. Don't miss the next episode where I will be discussing how do we evaluate for secondary hypertension. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.